Okay, let's say it. Your grandfather's long-standing GP advises against the procedure. What discussion item would you raise with the GP?
Firstly, it's important to consider that this is a very difficult decision to make, as the grandfather's life could be impacted on both ends of the decision, either one. Um, and the GP has known my grandfather for a long time, and also he's a medical expert, so you got to consider his advice strongly, their advice strongly. So I think the first thing you'd do is you'd let the GP voice their concerns to you and explain why they don't consider the procedure something they should go ahead with. Um, and then after listening to that, I think the main issues that would come about are the fact that the procedure has a 10% mortality rate. Now, it doesn't say it has any other long-standing effects, but it's a 10% mortality rate that's very concerning here. I think I would raise the concerns of a 10% mortality rate versus my grandfather dying in the next 5 years as per the diagnosis. It in the prompt says it's guaranteed to happen. So I would raise that concern about taking the chance to potentially prolong his life, improve his quality of life. Not so in terms of knowing that in terms of knowing that mentally my grandfather is not going to die, and that burden can be lifted from his head. So improving his quality of life by improving his mental health, and also the quality of life for the people around my grandfather. Of course, my mother, most closely connected to my grandfather, and if my grandmother is around, then yes, as well. So I think, to summarize, I would discuss the 10% mortality rate versus prolonging my grandfather's life to better his mental health, release the burden of potentially dying in the next, certainly dying in the next 5 years, and improving his quality of life, as well as improving the quality of life of people around him as well, and also removing the potential suffering that my mother might experience as well, and other members of my family, including myself.
Anything else?
Yeah, I would also discuss any potential consequences if there are any, but the prompt didn't indicate that.
Okay, your next question. How would you come to a personal decision about the situation?
Well, it's about, as I highlighted before, it's about weighing up my grandfather's quality of life versus the potential he might pass away in the next 5 years or due to the procedure. So I think we got to make one sacrifice here to make a good decision. And I think on one end, you're considering the 10% mortality rate, the fact that he might pass away straight away. And that can be very concerning initially. Initially, it can be very draining, very concerning, especially to myself and people around him. But the fact that he's only going to be around for 5 years maximum is also very concerning. And you got to consider that if his life can be prolonged beyond that, and if his quality of life can be improved for over 5 years, then I think that's an option much worth considering taking. Even though there's a 10% mortality rate, I think by considering the quality of life in the future for my grandfather, I think it would be a better decision to take overall. And of course, you got to consider what my grandfather wants here. So personal decision, I would listen to those people around me as well, in order to weigh up my decision, my grandfather's thoughts, the GP's thoughts, family members' thoughts. And then I would think about those and think about what I'm already thinking at the moment in terms of
So you're
improving my
considering
grandfather's
his
quality of life.
autonomy, isn't it?
Yes, it's his decision as well.
Yeah,
In
okay.
yeah.
Okay, your last question. How could you plan or reconcile these opposing views as a mediator?
Yeah, so you got to come to a compromise about these opposing views, and there are conflicting views between both the GP and the family members. Obviously, the GP is offering medical advice here, and in terms of high risks involved, and also the emotional suffering that might come about to family members as well. So I think to reconcile opposing views, you got to listen to what everyone around you is saying. I know that can be difficult initially, but I think having a family discussion about the whole issue, involving my grandfather, involving everyone who's involved with the issue.
Who's the other
Um,
one?
my grandfather, my grandmother, anyone else, and my mother, anyone else who's involved. Um, I think we need to have a discussion about it as a family, and put down to the table what issues are involved, and that way they can be resolved much more easily. And also consulting the GP. I did mention this before, but I think it's important to mention again, like you need to, as a mediator, you're considering all views on opposing sides, and you're considering the grandfather's autonomy and his right to make his own decision regarding whether he wants to take the procedure. Of course, he's being influenced by us, but I think it's important to highlight that after being informed about the procedure from a medical standpoint and an emotional standpoint, as it's a medical ethical right, that we value his choice as a priority, because he gets to make the decision in the end.
So that's how this question is asking, how could you plan to reconcile? So you talk to people, a family discussion, and okay. Anything else you want to add? You got 1 minute and 15 seconds left.
Yeah, that's fine.
That's fine. Okay. I'll stop recording.